Life after dyslexia. Most of us have come to accept the very commonly held belief that learning disabilities are a permanent condition, something you must learn to live with. My name is Dr. Phyllis Books, and today we'll be exploring alternative approaches in the field of learning disabilities so that now we have the possibility that learning disabilities can become a temporary condition. The film you're about to see was done on a local television station around 7 years ago in Dallas-Fort Worth. Before we actually get into it, I'd like to redefine a couple of terms. In that film, you'll hear me using the word dyslexia almost exclusively. Nowadays, I'd rather use the word learning disabilities, or learning differences, or learning disorders, which comprise sort of an umbrella term to encompass lots and lots of variations of learning disabilities. You may hear diagnoses such as attention deficit disorder, hyperactivity, ADHD, specific language disorders, dyslexia, dysgraphia, any of a number of labels. One of the very tricky things about learning disabilities is they come in lots of sizes and shapes in varying degrees of severity, so sometimes it's hard to pin down just what is and what isn't a learning disability. You'll also hear me refer to children. The truth is this work works on children of any age. Doesn't matter whether you're 4 or 64, whether you're a parent, a child, a grandparent, the results are the same. The work originally focused around the structure of the body itself. The structure forming the very foundation, the very beginning building blocks of learning itself. Before we started school, before we learned to read, before we started discriminating sounds, the nervous system within the body was building a foundation for us, for learning to take place. If you were this is a funny example, but if you were a house, the foundation would have to be laid very, very firmly for the rest of the house to be built. If the foundation weren't firm, you'd be spending a lot of time on repairs for cracks and other instabilities in the house. The same thing is true for anybody with a learning disability. We have to work on the very foundation itself so that all of the other learning systems can take place. And after years of doing this work, I know it works.
Welcome to DFW Weekly. I'm Karen Hoyer. Elementary teachers throughout the state of Texas are on the lookout for children with a disorder called dyslexia. It is a new state mandate to recognize these children early so they can get some help. It's frustrating for a child, parents, and teachers when he or she has trouble concentrating in school, see some letters and numbers backwards. Some can think thoughts clearly, but just can't express them right.
The improvement is tremendous.
Phyllis Matthews is talking about the changes in her 10-year-old son, Kenneth. He's been in classes designed for slow learners, but as with many children like Kenneth, they are not slow or dumb. They have dyslexia. It's a reading and writing disorder. For example, a dyslexic may read backwards, that is, from right to left. And many dyslexics often write certain numbers and letters backwards. She's taken Kenneth to several doctors, including a neurologist, who gave a medication commonly given to unruly children.
The neurologist did a CAT scan on Kenneth, and we found nothing wrong with the brain at all to say that he's not mentally retarded. He put him on the Ritalin so he would be calm in school so he could learn. I always felt like he didn't need it because when he would say not have it in the morning time before he gets to school, and the teacher called me because he was acting up, and Kenneth would say, well, Mom, I didn't have my medicine this morning. And he's so dependent on it. He is only at 10 years old, and here he is dependent on medication, and I don't want him like that.
So on June 10th, Phyllis took Kenneth to Dr. Phyllis Books, an Irving chiropractor who specializes in helping dyslexics. Here she's working on Robert Sparkman, a dyslexic who hasn't had treatment until he came to Dr. Books in early June of this year. She says therapy includes slowly moving the sphenoid bone, or the bone on the left side of the head.
And it's a very, very gentle movement, very gentle, moving the sphenoid bone back into place. If I would apply more than about 3 to 5 pounds of pressure, the body would resist and I would never make the adjustment. So it's very, very gentle.
It is a slow process that can take 8 to 15 treatments before the bone is realigned.
Breathe in and out. Breathe in.
Some exercises don't involve moving bones, but helping the patient breathe better, something she says is essential to keep the brain nourished.
In a dyslexic person, there will not that pumping action, which starts down at the sacrum, way down by your hips and goes all the way up through your spinal column up to your brain, that pump isn't working correctly.
Dr. Books says the whole idea behind moving certain bones in the cranium is to relieve pressure on the brain, and in this case, stretch the eye muscles back to normal. This, she says, helps improve reading, spelling, sound perception, and peripheral vision.
When loosening the bolt, I would tighten it before I'd loosen it, just because naturally that's how I did things.
Robert had to grow up not sure why things took longer than other children, from speaking and writing to playing sports.
It was very frustrating, but you learn, as a dyslexic, to learn tricks. And he will learn things like I would work a lot harder than everybody else at baseball because it just took me a lot longer to teach myself to do that stuff. So I would have to, where someone would work only 3 hours, I'd work 6, 10, 12. My mother noticed all the time that there was something wrong. They knew that I wasn't getting the grades. My sister and brother were honor students, and here I was at, the bottom of the list every year.
Dr. Brooks also gives her dyslexic patients exercises to do at home, reading and writing exercises, as well as physical exercises. That, along with her bone realigning treatments, is what Robert says has helped him gradually return to normal.
My reading has improved. I can read a whole lot faster and comprehend a lot faster, whereas normally I couldn't. Math, which used to take me, I have a thing I have to do every month, which is inventory. It takes me about 3 hours. I can now do in 30 minutes, tops.
And now Kenneth can do something he couldn't do before, read a book.
I like your hat.
Out of all the doctors and of all the treatments Kenneth has had, this has been the most quickest and effective, and not being on medication. And I have seen a drastic change in Kenneth.
What do you want to do when you get bigger?
I'm gonna be a pilot and be in the Air Force.
So you're going to have to learn how to read then, huh?
Right.
Now let me introduce my guest to you. Here, first of all, in person, is Dr. Phyllis Books. She was trained in New York and is invited to speak all over the country now. Also with us is Marcia Wood. She is a special education teacher in Fort Worth and has had some perception difficulties. Since seeing Dr. Brooks, she says she can concentrate better, her vision has improved slightly, and she has found that she has a great appetite for reading now. Thank you, both of you, for being with us today. Dr. Brooks, let me ask you first of all, because this has never been really clear with me, exactly where does the problem lie with dyslexia? Is it the brain, the eyes? What is it?
The problem with dyslexia is really all over the body. It works with survival reflexes, which may be in lower parts of the body. A lot of the emphasis is placed on the head because that's where the greatest percentage of our nervous system is. And dyslexia is a neurological problem. The new research that we're finding shows that this sphenoid bone, 100% of the time, is out of line in a dyslexic person. That sphenoid bone forms part of the eye socket. So the eye muscles that are attached to the eye socket are out of line also. So part of my job is to help get those muscles the right length. For instance, a person may be reading with one eye here, the other eye may be jumping here or here, so the tracking is not congruent. Another finding that is relatively new is that 100% of the time, again, a person with dyslexia will also have a TMJ problem. TMJ means temporal mandibular joint, and it is your jaw joint. People commonly think of TMJ when there's a clicking in the jaw or grinding your teeth at night. But in a dyslexic person, there is always a misalignment in this area as well.
What causes this? When the sphenoid bone, for example, is out of whack, so to speak, what causes that?
What causes the dyslexia?
Yeah. Or no, what can be what causes the fact that the bone may be misaligned? Are there causes for that?
Well, as with dyslexia in general, there may be many causes. Many times it's a birth trauma, some coming out of the birth canal. Many times I see forceps delivery, setting up a problem. Sometimes we think it may have happened in utero. That we don't know for sure. Sometimes the problem, so it may be genetic or hereditary. It may be emotionally induced if there's a trauma in someone's life. It may be chemically induced. I find it very interesting that 30 to 40% of the time, dyslexic people also have allergies, most commonly sugar. And interestingly, if sugar is a real culprit for a child or an adult, if I do the entire adjustment and he eats sugar, this bone will go right out again. And then I have to come back in and do the treatment. So an important part of my treatment is that sugar is eliminated or significantly decreased, and that the child do exercises at home to strengthen what I've done in the office.
Yeah. Marcia, let me flip over here to you. You say you've had some perception difficulties. Could you explain a little bit more what your problem has been?
Well, I remember even at a very young age trying to read. I remember the flip charts at first grade and trying to remember which W words went together, and I could still confuse will and with, and all those words looked alike. I also had holes in my reading, so that I would be reading a sentence and there would be a blank spot. Or if I came to a word I couldn't understand, didn't visually understand, I would make up a word. And I went through elementary school a lot, just making up stories. I mean, I became very creative in my approach to reading. And one of the things that I found the first time that Dr. Books gave me an adjustment was that I wanted her, when she got to the part where she was holding the sphenoid bone, is I just wanted her to hold it there. I remember saying, just hold that right there. It's the first time for a long period of time that my eyes seemed level. Because I can tell when I read that my left eye a lot of times will be doing the reading, and my right eye is weak and sort of like what, as you described, sort of floating on the page, and so I can only focus for a short period of time. And I'm now able to read for a longer period of time and read more information. The other thing that happens is I'm very distractible. Like I'll go into a test and I'll know the information. In fact, I may have tutored someone in the information and they'll do very well. They got an A in the test and I'll come out with a C on the test because I can't concentrate during the test. Someone will rub their hand along the paper and that's all I can hear. Someone will snap their gum, or they'll kick their foot up and down, and then I can't concentrate.
We're going to have to take a quick break right now.
As you can see from Marcia, there are many people who have compensated very well for their learning differences. Marcia has a master's degree in special education working with handicapped children. Since that film, she now has a PhD in learning disabilities and psychology. Interestingly, she chose a career where she didn't have to read very much, she doesn't have to grade papers, she doesn't have to deal with reading and writing and some of her perceptual difficulties at all. She's working with handicapped children and actually working on a strength of hers, which was her physical dexterity. There are lots of children who are falling through the cracks, and adults who have fallen through the cracks. For some people, it's very obvious that there is something disabling going on. Lots of us are just not working at our full potential. Children get shuffled through the school system because they're not really obvious behavior problems. And even if they are obvious, sometimes it takes a lot of time to get help.